Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, Anita Finley.
I'd like to introduce you to an ophthalmologist who is not only charming and beautiful, but so smart. We were very pleased to have her as one of our distinguished speakers at our previous Cure Symposium over at Palm Beach State College. And it was so good to hear her talk about not only being an ophthalmologist and what that entails, but all the new ways that people who need vision repaired. And most of the older people were very excited about cataracts, but she really talked about a lot of other things. So welcome to the show, Dr. Barbour.
Thank you so much, Anita.
Okay, so what we want to do now is to talk a little bit about someone who comes in for a typical eye exam and you find that they have cataracts. When do you suggest that they have cataract surgery? And how can they just wait?
Well, most of the time, upon examination, most patients will not be able to achieve their best corrected visual acuity with an examination that we call a refraction, which is to find out if new glasses will help them to see better. If they are, in fact, not able to see better with a new prescription for glasses, then we recommend that the surgery be performed.
All right. Now, cataract surgery. Years ago, that was a pretty devastating idea because I'm talking about 30 years, maybe even longer, where once they had it, they couldn't lie down a certain way. They had to, they couldn't go anywhere. That's surely changed, hasn't it?
Absolutely. At this time, cataract surgery is done through a very small incision, which measures approximately 2.4 millimeters. Can you imagine that?
No.
And it is a surgery that is taking place in about 10 to 15 minutes for most people. So the width of the incision has changed, and the speed or the duration of the operation has changed as well.
Isn't that difficult for you to make such a small incision and know exactly where to do this? And I guess the person is anesthetized?
Actually, we perform the surgery under topical anesthesia using eye drops and anesthetic ointment combined with intravenous sedation.
Huh. And that's new too, isn't it? Wasn't it always someone was put to sleep?
No. In the recent years, we have not been using general anesthesia for cataract surgery at all.
I see. Well, that's good. And so you're able to, do you use computers to help you to know exactly where to go?
We use computers before surgery to help us figure out the power of the implant, which needs to go inside of the eye. When we remove the cataract, it is a natural lens of the eye, and we have to replace that lens with an artificial lens. And so before surgery, we do the calculations to help us determine the power of the implant that needs to go inside the eye.
Well, before we continue, I do want to tell everyone you're listening to Monique Barbour, MD, board-certified ophthalmologist, and she's also the medical director at Clearview Laser Eye Center, which is there in Lake Worth. And I want to give you a phone number. If you'd like to call for an appointment, the phone number is 561-432-4141. That's 561-432-4141. Now, let's keep going with this. So is everybody's eye the same size? So do you have different size replacements?
Yes. Every individual has a unique length and width of their eye. The believe it or not, Anita. And as you can imagine, in ophthalmology, we have several instruments to measure these parameters. And so what we find is some patients will have an eyeball which is slightly longer or slightly shorter than the normal. And these things are taken into consideration when we do the calculations for implant surgery. We will end up with a certain number. For example, the implant power may be calculated at a power of 18 diopters, is what we call it. And another person may need an implant power of 25 diopters. So there's certainly a lot of variability, and a very exact calculation is needed for the patient to be able to see very well after cataract surgery.
So you have done all that prior to the surgery. When someone comes in, you do all your measuring, and then you know exactly when they are in surgery what they need.
Exactly.
Well, this sounds like a crazy question. Can you put in a color so that someone who has blue eyes could have...
No, it is not possible to put in any colors because that part of the eye is not touched during cataract surgery.
I see. It's just the
That's
lens.
the iris that you're
Right, I am.
And the iris is not touched, and the cataract sits behind the iris, believe it or not.
Huh, no.
So we don't touch the iris at all. There is an implantable lens to change the eye color. At this point, the Academy of Ophthalmology is not recommending that device because of the uncertainty, and there have been quite a few safety issues regarding the implantation of the eye color changing device, an implantable iris. So at this point in time, you will find very few surgeons who are using that device.
Oh, darn. Well, once you get permission, I want green eyes.
Me too.
All right, we'll both do it together, right? Well, no, I've always been curious about that, so I'm glad that you answered that. What is the recuperation time? So someone goes in, is that based on an age of a person, or is it strictly the operation?
Nothing is based on the age of the patient. The surgery recuperation is immediate. The patient can almost immediately be able to use the new implant, and they're able to see right away. And the next day, it gets even better. For the safety of the patient, we always place a protective shield over the eye immediately following surgery. When the patient comes to the office following the surgery the next day, we remove the protective shield, and the patient is then allowed to go on and use the newly corrected eye.
And you only do one eye at a time?
Yes, I only do one eye at a time. I don't know of any center in the United States that would presently recommend doing both eyes on the same day.
And I guess that's because, everyone needs to be sure that it's working without giving up the sight of the other eye.
Well, it's multifactorial in the decision not to do both eyes on the same day. The biggest concern is the risk of infection. If you have an infectious case on one side and then you go on to the other, potentially you could have two infectious cases. And that is something that could potentially be devastating for the patient.
I see. Will a cataract surgery last forever, or do you ever have to go and do it again?
The cataract, once it's gone, it never grows back. So it's permanent.
Well, that's it. So when you put it in, it's in, and hopefully it's been done by a professional such as yourself, and that you have a good job. And that's the other thing. A lot of people, I know of people who've had cataract surgery and it has not turned out how they wanted it. And, of course, you need to go, and what you can do is actually even interview the ophthalmologist, and that's why we have Dr. Barbour on the show, so you can hear her and how she cares and all her knowledge. Her name is Dr. Monique, Monique, last name is Barbour, and she's a board-certified ophthalmologist. She's medical director at Clearview Laser Center. That's CLEARVUE. They are located at 7657 Lake Worth Road in Lake Worth. Their phone number is 561-432-4141. Let's go into some of the other things you talked about at the Cure Symposium. What did you, I think you were talking about retinopathy, diabetic retinopathy a little bit?
Yes. Before we move on to that,
Okay.
I'd like to plug my website. If anyone has any questions or if you want more information, you can visit my website or my Facebook page. The web address is clearviewnow.com.
That's CLEARVUE now, right? Clearview now.
Exactly.
Right,
.com. And the website talks about some of the things that I do as a surgeon, and it also talks about some of the charitable work that we're doing through the office as well.
Yeah.
And we also have another location, which is out in Pahokee, and I'm there 2 days a week. I've seen patients out in the Glades area for your convenience. So I'd just like to mention that. We did mention at the symposium, which I was so delighted to have been a participant of, and thank you so much for the opportunity, Anita.
It was our pleasure, actually.
We talked about diabetes and its impact on the eye. And of major importance to me is something called diabetic retinopathy. This is an illness by which diabetes destroys the eye. And it is usually found in diabetics who have been diabetic for more than 10 years, who have a hemoglobin A1C greater than 10. What happens is the diabetes affects the blood vessels of every part of the body, and every organ in the body is affected. But in the eye, we can see the changes in the eye. It typically responds with a lot of swelling and edema, so much so that it has to be treated, and the prognosis is very poor. So it's something very important that every diabetic must, in fact, have their eyes checked at least once a year. And remember to keep the hemoglobin A1C under 7 at all times to prevent eye involvement.
All right. Now, one thing I did want to go back, I forgot. I was going to ask you, let's move back to the cataract surgery. You talked about a certain kind of system that you believe a lot in. It's a one procedure. You have something very special that you do that so that when you implant this specific kind of cataracts, the lenses of the implant, that you can see everything and not have to have one eye for vision, for distance, and one eye for closeness.
Well, the type of implant. The type of implants that are available are the Restore implant or the multifocal implant,
right,
and the toric implants, which correct astigmatism. This is a wonderful time for patients needing cataract surgery because there are so many options. The first and the most important option that we're talking about now is the fact that there is a laser-assisted cataract surgery. This kind of cataract surgery involves using the laser to make the incisions for the procedure. So that's the first question that we ask patients. Do you want the laser-assisted cataract surgery or traditional cataract surgery? With the laser, all of the incisions are made, and astigmatism can be corrected at the same time. The laser performs with a certain precision that is associated with slightly better outcome in terms of healing and visual potential for the patient. So it's new, it's cutting edge. This laser-assisted cataract surgery also will divide the cataract material so that the cataract can be aspirated with ease. So that's step one. Do you want the laser-assisted cataract surgery or traditional surgery? And the next question is, what kind of implant would you like? Do you want to be independent of glasses? Do you have astigmatism? So with those two questions in mind, we're able to offer the patient either the multifocal implant, which is capable of bionic vision, if you will. The patient is able to see distance, computer lens, and read fine print. The other question is, do you have astigmatism? There is an implant that will correct the astigmatism that we can put in to eliminate the astigmatism and definitely reduce the need for using glasses afterwards. So exciting times, I would say.
It is, and if this question were posed to you, what would you answer?
Well, I would definitely choose the one that is capable of correcting all of my vision, near, far, intermediate, everything. I would choose the multifocal if it were me.
Sounds like I would also, right?
Yeah, it all depends on what we find on the testing, because the testing is very important. It lets us know exactly what the eye is made of, and the lens and the width of the eye is very important. And to have the right calculation is imperative upon making the decision of the type of implant that should go in.
Yeah, I see that. So you have a very big job there, and every time I go there, your office is just filled with people. But you have an optician there, optometrist,
yes,
and I guess an optician, but you're the only surgeon. You're the only ophthalmologist that does this?
Yes, I am.
And you have a great background, actually. You're from Washington, D.C., and so my question is, what made you come down here?
Well, I got married. And my husband was this year.
That's a good answer.
Good answer, right?
Right, and it's warmer here. I wanted to go over what you were doing, Pahokee, because I did applaud you for that. There are so many people who do live very west into Belglade, but Pahokee is a place that most people don't even know where it is or know about it. But there are many people there who really don't get the good health benefits they should. And so I compliment Dr. Barbour for taking the time, the experience, for actually opening up an office there. And she just had a wonderful charitable event. It was a 5 mile, wasn't it a 5K walk?
5K.
Yeah,
Yes,
5K.
It was a 5K run that was put on by my foundation, which is the Smiles and Vision Foundation, to create awareness for diabetic retinopathy.
Yeah, and
we held the event in Pahokee, and it started on a beautiful morning in October. And we started the event in front of my office, which is on Barfield Highway. And the event ended on Main Street. And we were able to get some community involvement, but not nearly as much as we would like. So next year it's going to be bigger and better.
Right. We have to start somewhere. And so I think you
That's
planted
right.
your foot there, planted your eyes there, and you said, all right, listen, everyone, we have some necessities here, and let's get started. Well, that's a wonderful thing that you're doing there. The big problem,
Thank
I
you.
think, that if people don't go to their primary care physician and they just avoid everything, they're never going to know. I hope that the primary care physicians, when they're doing their examination, will notice that they have diabetes or that they have something, so then they could, and they should direct them to you to check about their eyes.
Exactly.
That's really...
That's the point of the event was to create some awareness and let individuals know that if you're diabetic, you've got to get your eyes checked regularly.
Now, I see where you have something, and maybe you covered it, but I didn't hear it said that you have microsurgical procedures including no-stitch cataract surgery. Did you talk about that?
Yes, that's what we've been talking about, the type of cataract surgery.
Oh, so no stitch.
And the fact that it's no stitch, and the recovery is very rapid.
So then people before, that's what I guess I was thinking about, people did have stitches when they had cataract surgery.
So. Probably in the last, I would say, 20 years, we have moved away from using stitches for cataract surgery.
Yeah, it's amazing that you don't have to have that. Mm-hmm. And so for people who, let's say they have cataracts, you would do one, and then how long would you wait to do the other?
Normally a week or two apart.
Mm-hmm. And do they have to do anything? Do they have to be careful when they bend down? Do they have to do anything different once they have it?
No. One thing we do advise against is underwater swimming.
You mean ever again or for a while?
Just for the first 2 weeks following surgery.
Okay. And so people, are they going to need glasses? Some people will need glasses, won't they, if they don't do...
Some people will need glasses if they do not choose the upgraded implant. They will definitely be dependent on their glasses.
But at least they now can see, which they can't. What did you describe to someone who's younger and doesn't understand what a person sees when they have a cataract? Or doesn't see?
Most often, a person will have blurriness of their vision. They may see glare and halos around lights, especially in the evening. And they're just simply not able to focus on anything, even with their best glasses on. That's when they know that they have some kind of impact and development of a cataract.
Do you think...
one other thing that should be mentioned here is occasionally when the person is diabetic, they will have a complex of eye problems, which includes a triple threat to the eye. They could have a cataract and combined with glaucoma and also diabetic retinopathy. So those three things are typically running together. When I see a patient, I always evaluate them with a complete exam to rule out both retinopathy and glaucoma.
Well, we haven't even touched on macular degeneration, and we'll save that for another time when we have you on again, because I know that's a very big issue, and I'd like to get your advice on that too, because, older adults, they have a lot of things that happen, and many people are taking good care of their bodies, they're exercising, they're eating properly. So one question I have is, cataracts, is there anything you could do to avoid ever having a cataract?
I don't believe there's any preventative measure for cataracts. It's such a multifactorial illness, and for the most part, I would say family history is at the top of the list, so that's something that you certainly can't change. Exposure to certain medications can cause cataracts. Radiation therapy to the face or head and neck area can cause cataracts. Trauma. Diabetes. So there are a number of factors that are involved with the development of a cataract. And at this point, reviewing the literature, there's not one preventative item that I can call to mind, with the exception of having a high antioxidant diet, such as a diet high in fruits and vegetables, and possibly avoiding exposure to cigarette smoke.
Oh, absolutely.
Those are the two things that I would think of.
And what about certain kind of vitamins? I mean, I have seen there are some vitamins talk about eye health, and but I guess it's probably, it probably can't hurt you. But as you said.
When we speak of vitamins and how it plays a role with your ocular health, we mostly consider vitamins that are manufactured for the prevention of macular degeneration. Those vitamins are built with a component of lutein and zeaxanthin, and these things are the components that we need in our retina to help prevent the progression and the development of macular degeneration. So as far as cataracts go, there's nothing really commercially available or otherwise to so-called prevent development of cataracts or dissolve them once they have developed.
Yeah, it's a lot to talk about. And, of course, there have been so many cutting-edge discoveries, and we're looking forward to something that's going to help us there. I know that you brought your daughters, this is on a personal note, to the Cure Symposium, and are they in college?
No, actually, my youngest daughter is in middle school.
No kidding. Oh, she seems so adult.
She just turned 12.
Oh, my heavens.
Very inquisitive, and I'm so glad that she came to see me because she was so proud of me.
Yeah.
And it was a really fantastic moment. Thank you.
Well, I think you'll be proud of something. The November issue has just come out. It's probably in the mail. You may get it in a day or two. Be sure to look at it because in the very back, we have a collage of pictures where we have you with your daughters in one of the pictures.
That is fabulous.
Yeah, you'll look forward. You'll look forward to it.
I would like to see that.
You
now,
will.
Is the copy online as well?
Yes, everything will be done. And also this radio show, which I guess we have to stop now. We're out of time. But this is turning into YouTube, and you'll be able to hear the whole thing on YouTube. And I'll let you know more about that.
Oh, please do. I can't wait to post that on our Facebook page.
Yeah. Well,
thank you so much, Anita.
You're great. I just love talking to you, and we'll talk again, and we'll do something on macular degeneration, okay?
Terrific.
Okay, thank you. Bye.
Bye-bye.